All right, I want to thank you so much for joining this July webinar session for the International Institute of Healthcare Leadership and Quality Assurance. It's an institute that is given to leadership excellence, more importantly, transformational leadership. And you'll be having more of this series. Today on the healthcare transformational leadership journey, we'll be talking about understanding leadership styles and theories. As much as possible, I want it to be collaborative or conversational. I'll love you to chat up, please. I need some response. And I'm so sorry we're starting like 8 minutes behind time. I also had to jump from another 2 hour training to this training. And so sorry about that. It's for some leaders in healthcare across Africa as well. So if you're just meeting me for the first time, I am Dr. Joshua Kolawole. I'm a trained quality improvement consultant, and I have my master's in healthcare quality and patient safety from Johns Hopkins Bloomberg School of Public Health. So, and in terms of transformational leadership, I'm a certified Lean Six Sigma Master Black Belt. So I'm certified to actually train. And apart from that, I have years of experience in transforming healthcare system, building digital solutions in recent years, and solutions that like 8 million people actually leveraging to access healthcare across the United States. I have about 1 million lives in the state of California alone that's using my applications that I worked with the team to leverage. Currently, I'm working on the state of Texas, and we're building a couple of platforms for both members and providers to be able to provide quality care. I want to urge you, if you live in this generation, you will see very soon in my slide, if you live in this generation, you're already a technology company. You are no longer an hospital. You are now a technology company leveraging software and hardware to provide patient care. If you think you're not one, you're probably living in another age and you're probably going to go extinct soon. That's just the position the world is moving towards. It's not, I didn't say that. And thank you so much for joining. I appreciate everyone. So going into today's class, we'll be talking about healthcare transformational leadership. And very soon you will see my passion about transformation. So please join me and stay tuned. One most important thing is I know we are not together in the same environment, but I want us to join this class with the mindset of a co-located team where we're all together in a room trying to solve a problem. You can see the image you have before you. You have leaders seated in healthcare leaders who wants to solve a problem, and they're looking at one another's face intently, waiting for that idea, that breakthrough idea to just pop up. And someone is able to solve the problem at its best. I will start with 4 quotes, and someone would have said, why 4? But you see, those quotes are something that has been with me for a while, and they are things that keeps me going. I love quotes a lot, especially the ones that speaks to the idealisms that I live by. Tul Gawande, I'm sure he's a popular guy. You probably would have seen his video somewhere. Not a musician, a surgeon. The future of healthcare belongs to those organizations that can deliver high quality care at a sustainable cost. And I commonly talk about this concept of cost because many a times when I say cost or when we hear cost, what comes to our mind first is just money. That's the price you have to pay to get something to happen. But I have over time learned that it's not only money that cost means. The idea of value for me and from QI knowledge speaks to the multiplier between quantity and quality divided by cost. Now, when you talk about this cost, we're talking about the cost in terms of finances. We're talking about the cost in terms of finances. We're talking about the cost in terms of energy that is being dispensed. If I can get less people to do a task, then the task becomes more valuable. The less the human energy or even the electrical energy that we have to burn. So if I can build a machine that consumes less electricity and still delivers like a 256 slice CT scanner, then I am producing more value because I will have to ultimately pay less electrical bills. Another thing is time. Another cost is time. If a CT scan in less than 5 minutes can give me the image of someone who is going through, who is having like ischemic stroke, and we need to make a clinical and investigational decision to know how fast we should progress in terms of delivering, what's it called? So there's this medication you need to give in less than 30 minutes to 1 hour. It's in the group of alteplase, tenecteplase. I've forgotten the class of the medication. If you need to give that, and I think NSAIDs to also work in that kind of category, if you need to deliver that in less time. But if this did not happen because one, CT scan is not available, or if it's available, you have to travel 7 hours or 2 hours, or you have to be on queue for 5 hours to be able to get it done, then the cost in time is significant. So what I am saying is that if you're going to be a great leader in this generation, you must be the one who thinks about quality, but also thinks about the cost of the sustainability of that cost. So leaders who can bridge that gap between quality and affordability will be true transformers in this generation. Another quote that resonates with me every time is that if you're going to be a leader in this generation, you must be compassionate. We now live in a generation where compassion reigns and compassion rules. And by compassion means you have to understand with people and help them, support them to grow. You have to stand with people when they are in crisis. I used to say there are 3 categories where people would always find themselves. This is the normal zone. But some people will be in crisis when you will meet them. And some people will be stretching themselves. There are 3 categories you would always meet people in. Is either someone is in crisis, they are in normalcy, and by normalcy, it doesn't mean they are not evolving. They probably may be evolving, or they are stretching themselves to become someone. So an example, I meet someone doing residency, trying to become a fellow. Maybe the person I would say is stretching themselves. But if I meet someone who is going through difficult life challenges, I'll say I met that person in crisis. And for some other scenarios, you meet people in their normal phase of life. In either of these 3 phases, you need to be compassionate. But more importantly, compassion is more needed in crisis and then more needed when people are stretching themselves. So at every point, you must ensure that you are a leader that has an open heart and that is compassionate enough. Now, do not take compassion as a weakness. Compassion only happens in the place of capacity. Compassion only happens in the place of capacity. I give this common example. If they rush some people to an hospital, maybe to the ER now, when they get to the ER, it's only the few people who either brings money out of their pocket and pays for the care of that person, and maybe the surgeon who wheels the person into the theater and does repairs and anything. Those are the people who are truly compassionate. Any other person, you're just exhibiting sympathy, because compassion always comes in the place of capacity. Please note that clearly. So for you to say he's truly compassionate, he must also have the capacity to be able to help. And he must have demonstrated that capacity. And then you have people who want to work in high-performing environment. I, as a person, I'm a task-oriented kind of person. I love people to perform at a very high rate, high-performing rate. But I've also understood that if you really want sustainable, high-performing organization, you must balance it with compassion. And so I welcome you to a world where we have to integrate compassion with high-performing scenario. In the last meeting I was explaining to people that the best kind of leaders the world can have are benevolent dictators. I say it, and I say this at every leadership forum I have the opportunity to go to. We need a world where people are compassionate, they are benevolent, but we also need a world that wants to deliver competently, high-performing. Because ultimately, when you don't deliver well, you pay the price of that sabotage. You pay the price. It might only be in time, but you will pay the price. So you don't want a system that is truly not performing. I also want to re-echo this again. Just like I've said earlier, technology is rapidly changing the healthcare landscape. Leaders who embrace technology And if you use it efficiently well, you'll be the leader of the future. So please, in any of your engagement going forward, at any point, at any platform, this is the crucial question you must ask. Do we have a software that can do this thing better? Do we have something, either a built solution or a system that can do this faster or better? In fact, I once tell people, when at every point when you achieve a feat and people are celebrating you, ask that next question. Is there something else that can do this better? How did I know? At a point, the world was actually driving what we call motor vehicle. Those vehicles are driven by axles. And fantastically, they did well in their days. But now we are driving electric vehicle, less emission. It must have been brought up by some people's thinking. Between axle and petrol-driven engine vehicle system, we have the electric vehicle that has the hybrid capacity. There has been transition in the thinking as long as technology is involved. But one important and crucial thing I need us to know is that your capacity in your organization to rapidly align is crucial. I am not saying you should keep spending money continuously on technology, so don't get me wrong. I am saying evaluate the digital readiness of your system continuously and adapt based on that digital readiness. Now, when we talk about digital readiness, that will now bring us into a new world. But by digital readiness, I am talking about a scenario where you have done a SWOT analysis or a PESTLE analysis of your team. You have also done the need or the gaps analysis in terms of what the problem is and how the technology how that solution can actually resolve it. When you now match, when there is a match, please hear me clearly, when there's a match between the capabilities in that software and the challenges in your organization, that is where you should go ahead. That is what we call digital readiness. The point when there's a match between the needs or the gap you have identified and your team and the problem you have, then you can then go ahead. But more importantly, remember, we are all now a technology-based. So if you're an NGO currently, working for an NGO, you are now a technology-based organization, leveraging the principles of non-governmental relationship and organization to provide care. And that's why you have mobile health, have every form of kind of health now that is electronically driven. Healthcare is a complex system. There are no easy answers. If I have come to tell you today that your life is going to become easy after this class and you become a leader in healthcare, I have simply come to deceive you. I want you to know categorically, you cannot be a leader and have a easy life. So when you are asking that, let them promote me, let them put me in a position I want to earn more, just know that what you're asking for is also that let them put me in a position where my life will become more difficult. Don't be naive and be a child to assume that you'll be the CMD earning in millions and your life will be simple and easy. It will never happen together. As the higher you go, the more complex and ambiguous your scenarios will be. The more difficult it will be to place answers, exact answers. There will be direct answers on the scenario. However, this is the advantage. The higher you go and you keep overcoming those challenges, the better you build that capacity to become more. And that capacity will help you. So, according to Jim Rohn, one of America's late, very great motivational speaker, he says, never wish it was easy, but wish you're stronger, you're wiser, you're better, because it will never be easy. The idea is, as a leader, you must be comfortable with volatility, ambiguity, complexity, and uncertainty. You must, and they say we live in VUCA times. That's VUCA. And you must be ready to navigate complex challenges. You would have to deal with a lot of things in the bid of helping healthcare system. Why am I saying this? I'm saying this to encourage us all that the whole ideal of becoming great, of leading system, is actually a complex ideology. And in every complex system, you always know one input does not determine so much response. And when you have an input, the input may not be directly linked to even the response you would get. It's not a simple system when if you input 3, you expect 3 to pop up on the screen. In a complex system, if you input 3, so many other factors can happen and 10 may pop up. And so many other factors can happen, -7 may pop up. Because in a complex system, there are so many interconnectedness, interrelatedness, and interdependencies among so many independent variables that can alter what the ultimate outcome will be. And you also have to understand that these things happen over time. I have this data, and the reason why I kept this data, and thanks to my friend, I think he's on the call, Dr. Paul, who helped fine-tune this slide. This data is showing you problems. And the reason why I kept it is that what makes leaders become great is actually challenges, is problems. So I welcome you to a world where you must love problems. So when we talk about healthcare leaderships and STAR, we're actually talking about that the world is filled with challenges, the world is filled with problems. And in healthcare, it's not exempted. And this is the way I picture it. I say, this is healthcare system. This is healthcare system. You are also embedded in a larger system called the world system. In the world system, there are 2 fights for power. There's the political fight for power, and there's the economic fight for power. Because you would always be among the crossfire between politics and economics, your decision making would always be influenced by issues. When they say PES2 analysis, I smile, because the whole analysis can actually be brewed down to 2, politics and economics. Just look at it. The whole idea of how the system works in an healthcare system is that we want to have the leaders and we want some people to be the followers. And then we want distribution of available resources. Ultimately. So because of this, when we say maternal mortality rate is high, it is not the problem. This is just the tip of the very tip of an iceberg reflecting a major problem that is under the water, assuming this is the water surface. This data is just reflecting something here. This is where the deep problem is. The deep problem is that in the heart of some leaders, they don't see a reason why they need to redistribute this money to be able to solve this problem, such that this data will come down. That is as simple as that. The leaders have deep problem here. Everybody wants to either become minister for health, department leader, something, and we cannot reallocate these resources to tackle this problem. The day we all make up our mind to connect this data to a problem that is deep inside us, and we're ready to reallocate resources, and we're ready to trade off our pride, our leadership, this thing, we will be able to face this data and it will come down. Why did I say this? I say this because I have an understanding of what is called system. A system is built to defend the system. I'm not sure you've heard that statement before. And if you have heard, please try and pieces it into a deeper method today. A system is built to defend the system. If you enter into an hospital, why the hospital is like that is because the people in leadership want it like that, because it feeds either into their leadership capacity development or the resource allocation distribution ratio that is currently happening. The day any alteration comes to those two, you will see a new dynamics come up, and that's when disruption comes. The day any disruption comes to disrupt either the leader or disrupt the available resources, there will be another response, and then they will create another system. So systems are actually created to defend a system. Just like a system is built to get the exact quality of results that it gets. And so please, this is just about the data. Now, to land on our concept of the leadership theories and style, because of our time, I also need to travel a bit faster. So please bear with me. You can actually listen to this over again. It will be uploaded on the Institute YouTube channel. So please, and the link will be shared as well. The leadership theories we have speaks to leaders are born and not made. We also have the trait theory, which built on the great man theory, saying no. I agree that leaders may be born with some inherent qualities. However, for them to become more effective, they need some traits that they need to learn, and they need to fine-tune those traits. The behavioral theory now springs up and say, no, it's not only about trait. We have also observed that there are some actions that some leaders put in place. Those actions actually define if they will be autocratic, if they will be democratic, or if they will be laissez-faire. So behavioral theory supports the three ideology of autocratism, democratism, or they want to just be. So you have in some scenarios, you have some leaders who are practically very autocratic. They are controlling. And by that behavioral theory, I'm talking about three kinds of leadership style that will be under that theory. So we have the great man theory. Leaders are born with some inherent, naturally occurring traits. That is, they don't need to be trained to become those. It's true to an extent. If you observe around us, you would mention leaders like Julius Caesar, yeah? You will mention Abraham Lincoln. You will mention maybe Franklin Delano Roosevelt. You would even mention, and I can even flip to leaders on both sides of the divide of good and bad, right? Because by the time I mention Hitler, I mention Stalin. These are men that the world, if you mention their name in any forum, everybody still keeps quiet. They are people who have who had some great man strength. But more importantly is that even with that, in the environment influenced a lot of things. So we would also have some acquired trait, but behaviorally, there will be things they will do and or they will not do that would define them. And then contingency theory came down, no, effective leaders are just based on context. If Mandela had lived in this generation, there probably will not be need for him to fight apartheid. The only reason why he became a great leader for his time was because he was born at that exact time. So based on the context he found himself, that was why he became an effective leader. Who else has another theory? You can put in the chat if you know the name of any great leader, please, that you want me. Oh, someone is saying benevolent dictatorship has been proven to work. Yeah, I know. It's been a concept all around. Discussed even here in the United States. That's the funniest thing, where we talk about the land of the free. So after the contingency theory, we also have transformational theory. If you have names, just for interaction, if you have names of great leaders that you know, either in your country or across the globe that you know, please, I would like you to drop them. Just drop the names and we'll talk more about maybe one or two great things they've done, and we can even analyze them based on this theory, please. I like you to put some names in the chat. If you can do that, that would be great. Put some names in the chat. Transformational theory focuses on leaders who create significant positive change. They are actually interested in altering the course of an event. They are people foundationally, people who see a problem, identify the challenges clearly based on the root cause analysis, and goes to the base and correct it. So I have Lee Kuan Yew, Singapore, correct, over 30 years, was able to move Singapore from a third world country to a first world country. He had some autocratic tendencies, if you ask me, but that was behavioral. All right, great. We have Dora Akuili. Yeah, I think that was the woman who turned around NAFDAC and brought NAFDAC to limelight then. Excellent. Excellent. The world has many great minds. Please just keep dropping names as they come to your mind, and we can factor which theory actually worked for them as we also analyze the styles, the kind of style that they exhibited. I would love us to know Martin Luther King. Excellent. And then we have the Martin Luther Reformation. So there are two Martin Luther, the Italian guy and then the American guy. The Martin Luther Reformation many years ago, the Martin Luther King in America who saw a dream. And the dream is one of the things I'm enjoying today, where I can also be in the same organization with another person that has another color of skin, and intellectually we can engage, and then we can deliver great solutions for the people in the United States. So and that's a brilliant transformational person. He has a day dedicated to celebrating him in this land. So we have transactional leadership style, which focuses on exchange and clear structure. Yeah, Dr. Ben Carlson, that's great. So for transactional relationship, compliance is rewarded, non-compliance is punished, and it focuses on efficiency. It's very excellent in emergency situations and maybe when you're managing just routine tasks. I want to submit to you, everyone, that we've all been involved in transactional relationship with people before. Either you as the leader or the follower, you must have been on either part of the chain. The goal is come into the hospital, do your job and go. If I employ you as an intern in my hospital, I expect you to deliver based on some job description. That's basic transactional. I probably, if you now want a transformational kind of relationship, then it would now be a redefined model. We also have the democratic leadership style, which speaks to a collaborative decision making where things are thrown openly. You help people grow through things. It's effective more when you have scenarios where you need to do policy changes, where you need to have patient care decision. America as a nation has sold democracy to the world. I don't believe all nations will thrive well on democratic system. I believe more in the benevolent dictatorship I mentioned, or maybe a compassionate dictatorship. Laissez-faire kind of leadership style. I have a team where I work currently. They call them, I think, custom solutions, conversational AI team. This team are so matured, so experienced that maybe years before I even joined the organization, they've been delivering solutions back to back. So this team, all I need to do is to schedule a weekly touch-based meeting with them, just to go and check what the developmental pathway is. They are so autonomous, minimal direction, they know what to do, minimal interference from us, but it can only work where you have highly experienced and self-motivated team. So you can see two things joining together: highly experienced team and self-motivated teams. Highly experienced team and self-motivated team. It is not a leadership style I will recommend in every scenario. I would only recommend it when I'm working with experienced minds and I know they are also internally motivated themselves. So if you find these two skill quality combining together, then you can allow the laissez-faire model of leadership. I have these 3 case studies before me, and I would love us to quickly review it in less than 6 minutes. So I'll dedicate 2 minutes to each one. And please, I'm actually having the chat opened on my screen because I love us to respond. Based on the leadership theory I mentioned, based on these 5 theories, you are supposed to categorize each of these case study as a theory. So read through case study A. During a routine period, Seattle, the nurse manager and administrator, encourages everyone to offer their opinions before decisions are made within the hospital, encouraging team collaboration and shared decision-making amongst the nursing staff. However, when COVID-19 or Ebola pandemic struck, she shifts to a less engaging style, making quick decisions to ensure the hospital's safety and compliance with new regulation. This flexibility helps the hospital navigate the crisis effectively. What kind of leadership theory is this? Who goes there? What kind of leadership theory is this? Can we have people? Just put in the chat, or you want to unmute. Either is fine by me. You can please, at any point during the conversation, if you have something, just unmute and say. I would find my own line of thought back. Don't worry about me. So what kind of leadership theory, in case you want to check the theories again, these are the theory. We have the great man theory, trait theory, behavioral theory, contingency theory, and transformational theory. So out of these 5 theories, this case study A, which one do you think is that? So someone is saying that's like a context leadership theory, like the contingency, right? Fantastic. That's a thinking, and I appreciate that. Who else wants to engage us? Contingency, thank you. Who else wants to engage? Of the 5 leadership theory discussed, which one do you think applies practically here? During a return period, the nurse manager, she opens up the conversation, helps everyone to make decision. But when things turned around, she altered things. Now, another dimension to view this because of time is to think through this with the eye of the behavioral theory. In behavioral theory, we say leadership is based undefinable and unlearnable behavior. And we said the proponents of behavioral theory advocated for three things. They said it could either be of these three leadership styles. They said it could either be autocratic, it could be democratic, or it will be what? Laissez-faire. Those are the three theories that the proponent of behavioral theory actually spoke to. So if we go back and check, we will see that during routine period, she was democratic. But when things turned around, she became autocratic. So that means the theory for this model may more align well with the behavioral theory. Or however, I will not rule out the fact that it does not have the contingency component of it. Just like you will see some primary and secondary. So if I'm to pick the first answer, I would say behavioral. If I have the ability to pick a secondary leadership theory, I'll probably pick a contingency, like you mentioned. Why did you choose this? Obviously, I just explained that. What other scenarios will warrant this kind of leadership style? Of course, when you have a routine period interjected by another period, let's say there's leadership shortage all of a sudden, staff shortage all of a sudden, maybe a drift from one hospital to another, that will be an issue. That will be an emergency. And then she has to step up and then become more autocratic. So there are several other scenarios we can paint that might not even be infectious diseases origin alone. It could be resource issue. It could be financial resources. It could be human resource. It could be material, like maybe supply chain challenges issue. And all these are real scenarios in healthcare. Case study B. Excellent. Fantastic. When the organization is also going through a transition of power. That's a great one. Now, a case study B also says, please, I would love us to engage via the chat. I have it open, so I can promise you I would even read it out. If you put it there, I have it opened on my screen, so I can read it out even while presenting. The case study B says the board of directors hires Dr. Gibson, a charismatic and naturally influential doctor, to lead a new healthcare initiative aimed at reducing hospital-acquired infections. Dr. Robert and Gibson is the same thing, so it's Gibson Robert. Dr. Gibson Robert's innate leadership ability quickly wins the trust of the hospital staff. He sets clear goals, motivates the team with his vision, and his inherent decisiveness helps in implementing strict hygiene protocols. And the infection rates dropped significantly, showcasing the impact of his natural leadership quality. If you were to pick a leadership theory for this, which one would you have gone for? The guy has some charismatic and naturally influential trait. He has an innate leadership ability that quickly wins the trust of the staff. And even the transformation that seemed to happen, excellent. I think I would more align with the great man theory as the primary theory for this. Why would I choose this as the primary theory? I want someone else to maybe drop an idea. I have quite a lot of brilliant minds on the call. Please, I would like us to be engaging. Let's drop our ideas. We're here to learn collaboratively. Now, why would I agree with the great man theory? These are the reasons. Natural traits is charismatic, of course. The other part is his leadership, innate leadership ability quickly wins the trust of others. But more importantly, if you read the implementation, the setting of the goal, motivating the team, inherent decisiveness, everything is all about Dr. Gibson Robert. It is in a transformational leadership scenario. You will see both the transformational leader, he will be building teams of transformed people, such that if Dr. A is leading Dr. B, C, D, E, in transformational leadership, Dr. B, C, D, E themselves are changing as Dr. A is changing. They are both changing together. But by the time it is only Dr. A that is making the difference happen in the hospital, then it becomes, the meaning is that Dr. A is a great man, is under the great man theory. But if you have a scenario where he's also working on building the capability of his team, then we would say that is a tendency towards transformational theory. However, you can, because he said they set a clear goal, motivate the team with his vision, And then he has an inherent decisiveness. All these points a bit to transformation. So if I'm supposed to pick a primary answer, the primary answer will be the great man theory. A secondary answer may be transformation. Maybe the story did not just give us the complete context, but that would be the secondary point. So I would love us to also, let's review case study C. Before we review that, look at your theories again, this 5 theory, and then read case study C. Case study C says Dr. Collins aims to transform the hospital's approach to patient care by implementing a new electronic health record system. Of course, by implementation, he articulates a clear vision of how the EHR will enhance patient care, provides extensive training to staff, and encourages innovation. His inspirational leadership and commitment to staff development led to successful EHR adoption and improved patient data management and higher quality care. If you are supposed to choose a theory, which theory would we give to Dr. Collins for case study C? Please let's drop messages in the chat. I have quite a number of people on the call. Let's please engage. What kind of leadership theory do you think case study C has? I have Mr. Femi Aderi Bigbe. I'm careful to pronounce other names. I have Dr. Mohammed Abdurrahman Umar. I have Dr. Lucky. I have Dr. Joshua. I have Dr. Paul. Please, let's engage. Dr. Abubakar. Let's engage. And I want to see what, if you want to unmute and speak, please feel free to go ahead. If you look at case study C, what do you think? So I will point out extensive training to staff. I will point out articulating clear vision. I will even first point out that he saw a problem. A problem? As a transformational leader, your goal is the capacity to see a problem, the ability to see a problem and then to innovate, the capacity to innovatively think about a solution. And that is how we know you as a leader. I used to say this: leadership is not about what you know, it's about who you are. You lead people with who you are, because it is only who you are that you can reproduce, not what you know. So I can have a lot of textbook knowledge about leadership in my mind, but until I am placed on a platform and I'm able to see problem, identify the system-based root causes of those problems, and I'm able to come up with a strategic design, think in frameworks and strategic design, and use that framework and design, that model, to create a solution. And when I create a solution based on that strategic design, and I'm able to build an implementation model, and after the implementation model, I'm able to think through monitoring and evaluation. If I am not able to do that, then I am not transformational. In fact, I will start questioning if the person is a leader. So your capacity to identify problem, do a root cause analysis. But the difference you will see between case study C and B is that Dr. Collins, though he's transformational, he also involved the extensive training of staff. This is what we call capacity building. And once you engage in capacity building, you are going to build multiple transformational leaders like you. And he also encourages innovation. Innovativeness drives transformation. Inspirational leadership. When we talk about McGregor Bonds gave us 4 classic ways to identify transformational leaders. 4 classic ways. Number 1 is idealized influence. They have strong ethical stand on matter. Idealized influence. Number 2, intellectual stimulation. They are competent. They know their stuff. Number 3 is inspirational motivation. Inspirational motivation. They know how to communicate, articulate vision clearly in a very convincing way. And number 4 is individualized consideration, where they are compassionate enough to specifically address the issue of one person And they're also great enough to address the issue at a team level. So individualized consideration, inspirational motivation, intellectual stimulation, and idealized influence. These are classic for transformational leadership. Now, if you look at the screen, you have a question on this side. It says, which leadership style is best for building supportive and ethical environment? Now we're talking about leadership style and not leadership theory. So please, and remember, these styles work under the theories in case you want to just understand it that way. So I'd spoken to some leadership style earlier. The first three, I spoke to transactional leadership style, democratic leadership style, and laissez-faire leadership style. I'm going to continue another three here. Autocratic leadership style, servant leadership style, and situational leadership style. Now, if you look at these leadership styles, the autocratic is, of course, individual controls decision. It's a form of centralized decision making with clear expectation. There's a lot of control and supervision. So I can imagine myself being the HOD pharmacy. I don't want control from the CMD. Neither do I want control from the director of clinical services or the director of admin or finance or operations. What I want is autonomy over the pharmacy. And so that always leads to problem, except in crisis, where autocratism would be understood, and or maybe we have high stakes. Let's say we have a visit from the federal government or something is happening, we have a crisis, then people will listen. But I would not say outrightly that autocratic leadership does not have its place in leadership concept. Because sometimes you just need someone who will take that leadership decision and be able to move things when needles need to be moved. Servant leadership. Leaders' role as servant first. But please, I want to correct an ideology here. It is the limitation of English language. It is the limitation of English language that makes us call it servant leadership. If you go and check the French interpretation, it is actually leadership servant. So please understand this clearly. People need to become leaders first before they can go and truly serve. I have this ideology and this problem with people who think they can serve and just be serving, and because they've been serving, they just are entitled to leadership. It doesn't work that way. You must build your competence to become a leader first. Now, so that when you are serving, we can even trust your service. The reason why this dichotomy has to happen is if you put servant in the position of a leader by a concept called halo effect, you will destroy that system. It's only a matter of time. But if you bring someone who has been groomed to be a leader to now serve the people, what this person will bring to the table is capacity. By the word capacity, I mean the person has solid character. He understands what an exact value system is. I mean the person brings competence. The person knows when to distinguish between right and wrong decisions, especially at a technical excellence level. The person has capacity in terms of compassion. He knows when to exonerate people and he knows when to punish people. The person you're bringing is courageous. They are courageous that they can stand against evil. They are courageous to give life like a mother and to kill like a father, to protect the system like a father would do. They are actually also people with clarity of purpose. And that is why we say they are visionary. Clarity of purpose. Because they are leaders before you allow them to serve, they will ultimately do this consistently. They won't be up today, down tomorrow, like a galloping ridge. So the reason is we need to ensure people build their capacity before we put them in leadership position to go and serve. According to one of the co-creators of Scrum, Dr. Jeff Sutherland, servant leadership or leadership servant simply means leaders, transformational leaders who truly want to serve. Transformational leaders who truly wants to serve. So leaders role as servant first, but the person must first be a leader. before they can serve. So please, don't, because someone is available and they are always the one carrying the microphone, carrying the speaker, running up and down, and they have not developed their leadership competence, go and give them the head of department. They must also be people who are empathetic, actively listening to others. They must be people who have the capacity to build communities and who are caring. They must be people who prioritize patient and staff well-being. And situational leadership just speaks to the capacity to adapt, to know when to be autocratic, democratic, servant leader, to know when to transit from one theory to another and be able to help people. Most importantly, there are people who can assess their environment. You know, they say the organisms who would survive are the organisms who are adaptive enough. They are adaptive enough that they know when to hide, they know when to fight, they know when to push, they know when to withdraw, they know when to. So as a leader in healthcare system, you know when memo needs to be written, you know when to keep memo and go for advocacy meeting. You know when opinion heads will matter. You know when your decision is to just relax and wait. You know when to engage, you know when to disengage. So you have a capacity to assess. If you can continuously scan your environment appropriately with appropriate tools, you will be an exceptional situational leader. So the answer to the first question is servant leadership, because they provide supportive and ethical healthcare environment. If you have the opportunity to pick two answers, you would have picked B and D. That's transformational leadership and servant leadership. But the primary one will be servant leadership. Number two, which leadership style might be less effective in a high-pressure healthcare environment? I'm sure you know that already. D is so obvious. You don't just want to be careless in a high-pressure healthcare environment. We have a concept in healthcare we call, or not healthcare, but like in quality improvement, we call high reliability organizations. In high reliability organizations, you are much more careful. You want you want deference to expertise. You also ensure there's strong monitoring, and because of that you will not open up. Because let's say you're managing a nuclear warhead, you definitely don't want to be laissez-faire about managing a nuclear warhead. Transformational leadership, and I will wrap up on this slide most likely. I know I'm being pressed for time, and I would like us to have some questions asked. And so because of that, I'll probably wrap up on this slide. But please, as it relates to healthcare, I already mentioned these key characteristics of transformational leadership as given by James McGregor Bonds: inspirational motivation, idealized influence, individualized consideration, intellectual stimulation. I can pick out some points here. I can call these the person is competent. I can say this person is compassionate. Compassionate. I can say idealized influence. This person has character and clarity, and then is consistent. Because if you're consistent over time, that's why they will call it an idealized kind of influence. And then inspirational. If you're internally inspired and motivated, people will simply see courage in you. They will say you're courageous. So you see people who stand like the name that was mentioned, Martin Luther King. I have a dream. He was able to rally around tens of thousands of both white and black to be able to challenge a status quo in a nation that was as well not favorable to a race. So transformational leadership is a style where leaders inspire and motivate their team to exceed expectation and foster positive changes. I love to also always make distinguish between the idea of just marginally increasing changes, just changing gradually, and then for someone who can wait for long at a point and then transform themselves. I prefer this form of transformation where I might need to wait more at this level. This person only waited for a little at this level and moved to this level. But this person may need to wait more at this level, but when it's moving, it's actually moving significantly. This person can move from a 2 to a 3 to a 4 to a 5 to a 6, but this person can move from a 2 to a 20 at once. That's the kind of transformation you need in this life and time where things are happening so fast that even the cost of running on gas may mop up whatever advantageous gains you may have made. When we talk about transformational leaders, they drive improvement and innovation, and they enhance patient care significantly. If you want to be a transformational leader, or if you think you are, these are points you can use to adjudge yourself. Are you visionary? Everywhere you go, do you always define what the true north should be? Do you build coalition of team of people to make things happen? It's not about you alone. You must build a coalition of people that can work together. You can't do anything alone. Just trust me. Do you engage power factors? By the time I talk about power factor, you already understand what I mean. Political and then economic. Those are the two power factors that runs the world. So in every healthcare decisions you're making, what's the dynamic of the people? And then what's the allocation of the resources? If you're a transformational leader, you would be someone under sound discipline, most importantly, working with war intelligence, because you will see the world as a discipline, as a rhythm that requires you to maintain it with sound discipline. If you would transform any system, you will be a person given to lifelong learning and pursuit of wisdom. You would always ask for what's the deeper inside. You will be someone who is given to monitoring and evaluation. Each of these points are a major topic on their own that we can actually make to be topics. And that's why I said this is going to be a continuing series. International Institute of Healthcare Leadership and Quality Assurance is given to building transformational leaders. And so you can see from what we've just said, how so many topics can come out of everything I'm saying within just this slide. You must be able to develop platforms. And when I mean develop platforms, you must be able to create platforms that will be able to help many people. If you have not gotten to that level, you're probably not transformational in your ideal. And I've enjoyed some transformational journey. I've also been part of many transformational ideas. I have seen that there's something called time and chance, which might be a positioning for supernatural alignment. I will not come and discuss with you that there is no things that doesn't align, things align in time, and you must align for the Kairos moment. So you will do everything, but you will align with the Kairos moments. In the Kairos moment, you better be found worthy so that you can leap. So for someone who is here positioning, when a Kairos moment comes, they leap. Like an electron who has gained that excited energy and is jumping from one energy orbital, that's energy level, to a higher orbital or energy level. And that's the journey of transformation. This thing also has the same methodology in physics as the way it has it in psychology or economics. The idea about understanding how healthcare systems should respond to scenario is that you're building a team of people working together in a ward, developing things, and gradually you're scaling it up to maybe the whole unit or department, and then from the department to the whole hospital. You keep leaping from one point to another. So you're not just changing in a rush to just do things. You're actually fundamentally relearning. The reason why this takes time is that you have to fundamentally relearn the process. So if we need to transform the healthcare system in Africa, we need to first relearn the nature of our people. When we understand the nature of our people, both in the leadership, we understand how progress are made on African soil. If you want to make progress, how is progress made? What is the price that comes with each of the progress? When we understand all this and relearn what competence we need, we can then start brewing a capacity to leap. The next thing is learning will now go to how we think, because thinking comes with our capacity to build designs. Nothing delivers more than the capacity of its design. Go and look out if you want to build a house, if they have designed it so that the foundation can only take 2 stories. If you go and put 4 stories on that 2 story, it may look like it is standing. It's only a matter of time. Someday it will kill people. So I tell people, check your design. If your design is not strong enough, go and redesign. How will you redesign? You need to go and relearn, rethink, and now come up with a new design. When you come up, because you will never deliver more than your design. The design of the male gender is different from the design of the female gender. And that is why we deliver based on the capacities of those designs. So we need to understand what the concept of designing is. And then we will now learn how to rebuild. If you want to learn how to rebuild, you need to understand these dynamics. You need to understand how to rebuild in terms of motivation and ability at personal level, at social level, and at structural level. I know time is gone, and at this point, I would like to open up to question. I'm 2 minutes above the hour. I want to appreciate everyone who has been able to join. And please, at this point, I want questions. Do we have questions, please? You can use the chat option. You can also speak directly. You can unmute and speak directly, whichever works well for you. I'd like us to ask questions. Dr. Abubakar Jafar Usman, Dr. Lucky, do we have questions? And by the time we share the link to this presentation, we can actually share with our friends as well, anywhere in, as in share with them. And now, if in the absence of a question, if you can just give me 2 minutes, I would be done. I want to balance the concept of this motivation and ability if I have the time, if there's no question. So just give me 2 minutes. The first thing is anything you want to change, let it align with the personal motivation of the people. Find a way to get what motivates the people and align it. But also understand that you have to build their personal ability. So you have to get things, knowledge-based things that would help them become better. If they don't have access to a tool, you may need to get that tool. You may need to buy them a laptop. Maybe I can be that simple. Because if they don't have a system and you need them to make things happen, and you have the option of either a phone, a laptop, or something, and if the phone would work perfectly fine, but you need to get tools. You need to get personal ability if you want things to change. We don't, so I can motivate you till tomorrow, but if I don't give you ability, there's also a challenge. The second part is social. The reason why social is significant is that at social level, people take different decisions. Thank you for that comment. That's appreciated. People take different decisions. At an individual level, we can all agree that we will improve our country, Nigeria, or we will improve Africa. But at a social corporate level, you will see people taking a different turn. So because of that, at every point when you need any transformation, you must engage people at a social level. So you need to pay attention to what are the things that socially motivate them. What are the ways you can leverage that social motivation to get them to commit? Then you also must build their social capacity to be strong enough to stand against some decision. Because some social decisions will compromise the change. So if you don't build that social ability to tell all of them that, look, we all must unite together to wash our hands if we want to prevent the transmission of organisms in this hospital. And we now at social level commend one another to do it and work against anyone who wants to work against the social structure that we're building. And then structure. At every point, you need to put in policies, you need to put in forcing functions, put in technological restrictions that will structurally prevent people from doing what is wrong. Apart from structurally motivating them, you must put in structural, functional steps that will prevent them from doing what is wrong. I want to thank you so much for this time together. It's 6 minutes above the hour. I really want us to keep to time. And so I only used the time that would have been meant for question to explain that part. The next series will be in 2 Saturdays time. That's the 27th of July. And hopefully we're going to do some great work, and invited guests would be showing up to give us a session. And then in August, I will continue this session on healthcare transformational leadership. And we'd also have some invited guests as well. So a month upon month, we'll be having invited guests. We'll be having some discussions. And please, the International Institute of Healthcare Leadership and Quality Assurance will be passing across as much information as they are available on the WhatsApp group at the point where we need you to register on the website. When all the nuances have been fine-tuned, user acceptance testing has been completed, would let you know. So we're engaging, and it's growing, and it's becoming bigger. We're engaging great minds across Africa and globally to be able to drive our transformation for healthcare leaders. And hopefully we know you join us on this fray and you consistently join our webinar session. This will be a yardstick for the membership and the fellowship program, and that is also being designed and I'll come forth in the near future. But as much as possible, I appreciate every one of you for joining, and would also keep these details of attendance, and then would also work on the certificate of attendance for those who joined. Thank you, and I appreciate you. Have a great afternoon from my end, and a great evening from your end, wherever you are. And if it's morning on your end, have a great morning. Bye.